back here on Healthy Living. We are here with Dr. Jones, with Dr. Blocker. Thank you so much for joining us together. And I'd really like to introduce the star of the show, and that is the robot behind us. Can you two share with us a little bit about what we are looking at, what robotic surgery is, and why it's so important in your practice and here for Novant? So I'll go ahead and Kevin, start with you.
Okay, so just looking at the equipment behind us here,
there we go.
This is the robot itself.
Okay.
And it has an arm attached to it. And so we're able to do hip and knee replacements with this. So what we have actually is the knee attachment here today, and we use that to trim the bone back a little bit. This is what I like to call a receptor right here.
Oh, yeah. Do you feel like we're in the way?
Sorry. So this receives information from the surgical field. And then we'll be looking at a monitor, which is right here, which will actually show the patient's bones, an image of that in 3 dimensions along with the implants.
So let me ask you, Dr. Blocker, what are the implications of that? What makes that so special as far as outcome and patient care?
Yeah, so well, one thing I like to start with when I'm explaining this to a patient is, first of all, we still do the surgery.
Okay.
The robot doesn't do the surgery. The human physician does the surgery. And I point out to patients all the time, there's a handle right here for the human hand.
I like that.
So we drive it. It doesn't move without us. But you know, before the surgery, the patient has a CT of their hip or knee.
Okay.
And that's a way of digitizing that body part into numbers, binary numbers for the computer brain. And then it allows us, in the case of knees, to what we call balancing the knee. And it's a little bit hard to explain that, but I think I can, in a nutshell. When someone has arthritis of their knee, they might have a bowed leg, and the ligaments on one side are going to be tighter than the other. So the robotic arm allows us to make these cuts such that when we put everything back together, the ligaments have equal tension on both sides, and that's what we call a balanced knee. We had ways of doing that without robotics, but this has just leapfrogged us with technology so that it's we can very quantitatively accomplish a balanced knee.
And then does that help with patient recovery time?
It does, and just to add to that, so we're able to really scientifically balance the knee now, which before what we did in some ways was more art than science, and we would be looking at our cuts, looking at did everything look parallel, and then maybe release some of the tissue to make sure that it becomes parallel. Now what happens is our robotic plan actually brings us back into balance so we don't have to do so much dissection.
Ooh, I think that sounds amazing.
And I think that is one of the reasons why you get a quicker recovery for most patients and maybe less pain most of the time.
Are most people candidates for this kind of surgery, and is this something that you determine when a patient comes in to see you?
I think, in my opinion, there's not someone who would not be a candidate for it. There's always exceptions, but the vast majority, 99%. I can't think of a time when we weren't able to do a case robotically. It makes what was a very difficult case. I won't say easy, but definitely easier because of the balancing feature we just talked about. So it's a technology that's I think here to stay.
Oh, it is. And you said when we were talking, one of the things you love about your field is it has changed exponentially, even in the past 5 or 10 years, and you see it continuing to do that. Talk to us about some of the things that have shifted, or the things that you're doing now that you weren't doing, let's say, 5 years ago, when it comes to hips or knees. Well, we even talked about the one procedure, IT band procedure.
Right, where it's a procedure where I stay above the IT band when I make my approach, so that I think helps the recovery. But one thing I like about orthopedics is I think things keep getting better. They keep doing things to make it easier and more accurate for us. And for example, on the hip, so if we talked about the hip, it's placing the socket. That's the real challenge. You know, we do a lot of these. We know how we would place the socket, what it would look like. But one of the things we don't know a lot of the time is the variation in anatomy in the pelvis, because there's a lot of variation from patient to patient. Now, when we walk into the operating room, we have an image of the patient's hip in 3 dimensions. We know exactly where the implants are going to sit, and we know the orientation of the implants and the size of the implants even before we start the procedure.
We feel so lucky here at Healthy Living to be able to have professionals like you to talk to. One of the things that's so great about talking to you all is you make it user-friendly. Is that fair? Just listening to some of myths debunked and getting kind of accuracy, but I don't feel like you dumb it down. I feel like we got a real good indication of what you're going to do when you're here at Novant. I think we're really privileged. Thank you both for sharing and talking with us today. We want to thank all of you for joining us here on Healthy Living. Have a safe and wonderful week. Bye-bye.